Okay, everyone, welcome to the Pfizer meeting. I see one of my members here. So Councilmember Jurinsky is here. So we're going to go ahead and get the meeting started. We have a couple presenters from Adams and Arapahoe County Health presenting today. So I just want to introduce myself and the committee members. I'm Councilmember Angela Lawson. I'm the chair of the committee. Online as well, we have Councilmember Jurinsky. She's the vice chair, and Councilmember Gardner. He is also a member of this committee. And I also want to acknowledge Mayor Kaufman. He is online as well. So thank you, everybody, for attending the meeting. We have no consent items. Councilmember Jurinsky, do you approve the minutes of 4/26?
I approve.
Okay, thank you. We're going to go on to our federal legislative update. Lori. You're on mute.
Thank you. I apologize. The House and Senate have been working on appropriation bills. This week, the House was out. The Senate was in for 2 days due to the federal holiday on Wednesday. Next week, the House is in and the Senate's out. It's been pretty quiet here. They're not expecting to get much legislative activity done before the election. However, there is work being done on appropriations. So next week, we have 3 pending earmark requests that Congressman Kaufman, Congressman Crow requested on behalf of the city. And those are all in Transportation HUD Appropriations Subcommittee on Thursday, June 27th. That subcommittee is considering that bill, and we should have the bill text, and I'll know if our request made it into the bill, because it's up to, at the end of the day, the subcommittee staff to decide which earmark requests make it and which ones don't. On the Senate side, they will start working on appropriations the week of July 8th. And we have 3 pending in Transportation HUD and 1 pending in Commerce Justice Science. And Transportation HUD will probably get done in subcommittee mid-July. Both House and Senate Appropriation Armed Services Committees have passed the National Defense Authorization Act. The Senate is expected to consider it on the floor sometime in July as well. There are a number of grant opportunities out that I know your city staff are working on. One is Reconnecting Communities that we have considered for Havana Street Corridor. That notice of funding opportunity should be out in the next couple of weeks. And I'm working to schedule a meeting with USDOT with your staff to so they're make sure they're prepared to apply for the application. And that's all I have for right now. Does anyone have any questions?
Yes, is there any questions from Councilmember Jurinsky? I don't see if Councilmember Gardner's on, but Mayor, do you have any questions?
Oh, just one. I'm just
Okay.
wondering if I know I put a request in through Congressman Crow's office. Don't know what happened to it, but we have an Army reserve facility on the Entrance Medical Campus, and I've talked to the commanding general for that, and he's interested in moving to Buckley Space Force Base, and so we just need to know what the process is.
Okay. I remember y'all mentioning that briefly when you were in town last month. Okay.
Yeah.
I can check on that.
Okay. Thank you so much, Lori, for the update. And I appreciate your time. Have a great weekend as well.
You too.
Okay, thank you. Liz Rogers, she's going to be talking about the notice of proposed rulemaking rescheduling marijuana regarding a letter.
Thank you, Councilmember Lawson. So per our 2024 federal priorities, one of the topics we had discussed was to reschedule marijuana from a class 1 to a class 3 drug. In this way, it opens up federal IRS allowances for tax breaks for our marijuana industry. This is, of course, integral to the city when it comes to the revenue that we see from those taxes. So the Biden administration had put forward a notice from the Department of Health and Services as well as the DEA to move forward with that reclassification. And as city staff, we think it would be appropriate and also in line with our priorities to submit a letter, a comment letter to illustrate our support for those changes.
Okay. Councilmember Jurinsky, do you have any questions and do you support the letter?
I don't have any questions and I fully support it.
Okay, I fully support as well.
Thank you.
Okay, thank you, Liz. So water update, Lori, we have some support letters as well that you want to go over before we start our presentation. I mean, Kathy, I'm sorry, not
Oh.
Lori, Kathy. Sorry,
Good a-
Kathy.
Good afternoon.
Okay.
No, that's okay. Because
Sorry
yeah,
about
Lori,
that. I didn't mean
I knew
Lori,
what you were going to
thought Lori,
say,
didn't
but I
hear
was just like,
face.
oh, I didn't know I was on for this.
Kathy, yeah, sorry, Kathy.
Lori knows these bills just as well as I do, I think, too. So, but yeah, I've got a trio of bills for you. Aurora Water would like to send support letters for all three of these. The first one is a turf replacement bill that Senator Hickenlooper is getting ready to introduce. I don't see that it has a bill number yet, but I know that it's getting close. And so the turf replacement, of course, we signed that West-wide MOU to further water conservation, and the mayor and Marsha Brown worked really hard to do the ordinance a couple of years ago, and so this is in line with both of those. And if there's any questions on the turf replacement, otherwise I can move on to the next one. It's on page 11 of your packet.
Lori, why don't you, Kathy, I keep seeing Lori's name up here. I apologize. Why don't you go through all the support letters and then we can just go through and then go through all of them. And then if we have questions overall, we can ask those questions and then just approve or see what the committee wants to decide on the support of them.
Perfect. And the second bill starts on page 18 of your packet and is the Drought Preparedness Act bill. And this one, it really just reauthorizes really good Bureau of Reclamation programs that are set to expire. So all three of these bills relate to the Colorado River Basin and just recovery and stability in that basin. So the Drought Preparedness Act is the second one. And it allows reclamation to work more efficiently with neighbors and partners. And then the last one is, let's see, on page 22 of your packet, as I plug it in as well, and that's the Water Data Improvement Act. And this similarly, it supports some existing reauthorizations for the United States Geological Service and adds some new ways to improve water management. So you can't manage what you can't measure. And so this is helping us measure our water resources across the West. And so that is bill number 3.
Councilmember Jurinsky, do you have any questions and do you support the letters from the Water Department?
I don't have any questions and I support all three.
Okay, I support as well. Mayor, did you have any questions on any of these letters?
No questions.
Okay. Okay, all right. Well, thank you, thank you, Kathy, for presenting all the letters, and I'm glad we'll get all of those out to our legislative delegation as well. So thank you so much.
Thank you very much.
Okay, now we're going to have a presentation from Adams and Arapahoe Health Departments, and it looks like we have Heather. I'm sorry, I had a different individual on here, but I'll let you introduce yourself, and Alexa. Oh, and Callie. Okay, it's Pre-Kim is here as well. So I'll let you both introduce yourselves because I had a different list of who was actually going to be attending. So, and I'll let you move forward with your presentation. So thank you for being here as well.
Fantastic. Good afternoon, everyone, and thank you so much for the time. I'm sure you all are aware that in January of last year, both Adams and Arapahoe counties launched new individual health departments. And this is a quick opportunity to share a little bit about how we are working together and working in Aurora and some opportunities perhaps for us to increase those synergies and answer any questions that you might have. So my name is Heather Baumgartner, and I've been working in public health in Colorado for about 25 years, and was with the State Health Department, Tri-County, and now excited to be with Arapahoe County Public Health, where I'm the Director of Partnerships Planning and Community Health Promotion. And several of our colleagues are also on the meeting and I'd like to invite them to jump in to answer any questions or add any points as Callie and I walk through some information. So I'm going to turn it over to Callie to introduce herself and kick it off with some information about Adams County Health Department.
Great, thank you. Can you hear me?
Okay, great. My camera, it looks like it's been disabled, but I am here. So I'm Callie Preheim with Adams County Health Department. Thank you so much for inviting us, and thanks to Liz for all the coordination that you've done for us on the back end. I'm the Public Health Planning Evaluation and Senior Public Health Planning and Evaluation Senior Advisor at Adams County Health Department, and I was also at Tri-County, so we have just a great close relationship with Arapahoe. And we're glad to be here to present to you today. So I'm going to share my screen. Please let me know if you do not see the full
Can you
view.
make it a little bigger? Oh, there we go.
Is
That's
that better?
perfect.
Okay, cool.
Yeah.
Thanks. So we're going to be talking to you today about really just services, public health services offered in Aurora and the partnership that we have together. Quickly, we're going to go through our individual health department kind of background information. So as you know, both of our health departments kicked off January 2023. The Adams County Health Department mission is to responsibly serve Adams County community with integrity and innovation. I'm not going to go through everything that's written here since you can read it, and to save time. We have several offices. We don't have any in Aurora right now. Our main kind of administrative office is in Brighton. We also have Brighton Services, where we offer WIC and nutrition, Commerce City, North Broadway, and I'm sorry, there's a mistake on here that should say Westminster. Heather?
As Kelly mentioned in the slides, we also include Arapahoe County's mission, purpose, and as I'm sure you're all aware, working towards health equity is a key foundation of the work of both departments. We've included our equity statement here also for reference. And then the next slide shows the office locations for Arapahoe County Public Health. We currently have 4 sites, 2 of which are located in Aurora, one at Colfax and Chambers and the other at Hamden and South Chambers. At those locations, you can connect with environmental health, sexual health services, immunizations, HIV and syringe exchange, WIC, and our nurse liaison program.
This is our leadership team. Again, I won't name everyone for you. You probably recognize some of these folks if you were engaged with them at Tri-County. And this is our Board of Health, which was established in August and has no commissioners or other elected officials. So it's very community focused.
Leadership for Arapahoe County Public Health is listed here. Our director, Jennifer Ludwig, probably looks familiar, as well as our chief medical officer, Dr. Christopher Urbina, who headed up the state health department for quite some time. Jennifer, as you likely know, has been a local public health director in the past and was also deputy director with Tri-County Health Department, and contact information is provided there. On the next slide, we have the 7-member Board of Health for Arapahoe County Public Health. We meet every 3rd Wednesday, and contact information is provided there also. And we're excited to have a really supportive board with lots of depth and breadth in terms of the perspectives that they're bringing to the table for us.
So what is public health? I'm sure you all know, having been very visible the last several years. We're sharing here kind of the new framework that the state health department has put out, which looks at services public health provides by foundational public health services, as well as kind of the foundational public health capabilities. So these include things like communicable disease prevention, investigation and control, environmental public health, maternal child health, and adolescent and family health, chronic disease, injury prevention, and behavioral health promotion, and access to and linkage to healthcare. We do a lot more too, including assessment and planning, and all of the things kind of listed in blue. We really are trying to approach public health through the lens of this kind of quote from this public health framework, Public Health 3.0, that comes from Health and Human Services, that public health is what we do together as a society to ensure the conditions in which everyone can be healthy. So public health is what we do, it's what you do, it's what we all kind of do together for community. And then these are a list of the services that we offer as your health departments. So breastfeeding peer counselor support, they're listed in alphabetical order. Lots of different breastfeeding support and support for families and new moms, child fatality prevention review. Again, I don't think I'm going to read them all, but we will have time for questions at the end. And in fact, if you have any questions now on any of these services, please go ahead and speak up. And I'm not monitoring the chat. So if anyone else is and can kind of note those, that'd be helpful. Heather?
There's no questions. I mean, I can kind
Okay.
of see, so, but yes, continue.
Okay. Okay, great. Thank you. And I guess before I go on, I'll just say that the services we provide, which is kind of mentioned in the previous slide, we really work at lots of different levels, as I'm sure you know. So we work at the population level, looking at systems and how they're connected. We work with individual people, providing kind of direct services, and then we work everywhere in between.
This next slide highlights our regulatory and emergency response roles. So a few things that I'll just call out: air quality monitoring, communicable disease, case investigation and contact tracing, inspections of facilities like childcare centers, swimming pools, spas, body art facilities, tracking of community health data, communicating that data, investigating complaints, might be related, anything from, could be rat infestations, you name it, we receive and respond as we're able or triage those complaints. Coordinating with hospitals, schools, emergency response, and elected officials, et cetera, related to emergency preparedness and response. Food safety trainings. Let's see, infectious disease investigation and control. So anything caused, by viruses, bacteria, parasites, meth contamination remediation oversight, on-site wastewater licensing and inspections for those who have septic systems, radon testing, retail food inspections, solid and hazardous waste inspections and education, and then vector-borne disease surveillance, so things like mosquitoes and ticks. And if you want to go ahead and forward to the next slide.
I have, is it not showing?
Oh, thank you. Thank you. See it. And this third one kind of lists out our roles that, as Callie mentioned, we work at a lot of different levels in both service provision, but also in terms of collaborating with partners, tracking health issues, analyzing and sharing data, and working together in many times toward policy and systems changes. And you can see a lot of that reflected in the list of this slide. So working to identify barriers to access to care in ways that we might come together with others to identify where those biggest pain points are and see how we can create change in those spaces. Assessing community health. So we'll talk in a minute about our 5-year statutory requirement to do comprehensive health assessments of the community and work to meet those high priority needs. Excuse me. Co-creation of strategies with our partners and the community. Example of that might be we together, both health departments, meet monthly with Aurora Public Schools representatives to talk through what they're seeing, how maybe we can come up with some strategies together to address that. Federal, state, and local policy engagement, as Callie mentioned initially, tracking those, seeing where we might be able to help with testimony or education to inform the issue. Working on food security issues and how we might identify supports for food systems and access to healthy foods. We do a lot, and you've probably engaged with members of our teams around some of the, particularly during COVID, some of the data analysis, capturing analysis and communication that we do around really any health-related issue. Healthy aging is an area that we are increasingly working in and eager to partner around. Injury and violence prevention, efforts focused on maternal and child health, mental and behavioral health promotion, population health epidemiology, and one of our partners who leads that for Arapahoe Health is on the call if we have any questions there. Program planning and evaluation, really anything related to chronic disease prevention, education, and targeted efforts to advance health equity. So having that lens really with everything we do, where do we see the biggest inequities, and how can we engage to really work proactively to address those. A lot around tobacco, vaping prevention, really anything related to substance and overdose, and then topic-specific assessments, whatever we can do to better understand health-related issues, what the drivers are, what the trends look like, to inform what that work might look like moving forward. And this next system slide, one of the things we wanted to really call out is that there's no wrong door between either agency or any of our facilities. So we're pretty well connected, work well together, and no matter where you reach out, we will likely be working together either in front of or behind the scenes to get that issue addressed or work together towards solutions. A couple of other ways that we do partner very commonly. One would be around community engagement events. A couple examples I thought I would mention recently were the Aurora's National Night Out. Well, that one's coming up August 6th. We're looking forward to participating in that. Shots for Tots and Teens. Just had that MLK Library and have another one coming up, and recent vaccine clinics, looking at the clinical events at Kenton Elementary and Red Hawk Ridge Elementary. Also a resource fair at Aurora West Community College Prep Academy, Aurora Pride, of course, and Aurora Wellness Community Fair in the past few months. Safety collaboratives are another one where there's a lot of activity happening in that space. And some of the places where we're partnering together around include Aurora Youth Prevention Coalition and the Aurora Place-Based Crime Prevention Initiative. Community health planning, another big piece of it where we proactively work together, making sure that we're on the same page and have good role clarity, and peer-to-peer collaboration between the agencies and our counterparts across other local public health departments. So I'll pass that over to Callie next again.
Thanks, Heather. So now we're going to talk a little bit about kind of our individual strategic and emerging priorities. At Adams County Health Department, I'll talk a little bit more about the Community Health Improvement Plan, but we've identified 3 priority areas. Those are the top listed here on the slide. So economic security, housing, and then access to care. And we're talking about kind of comprehensive access to care. These are our identified Community Health Improvement Plan priority areas that we're working on with the Adams County Thriving Communities Collective. We have lots of representatives from Aurora. We even have some folks from Arapahoe who are participating. Our other priorities right now really relate to behavioral health and mental health, environmental justice, air quality, food security, tobacco use prevention, and youth engagement. And I'm just going to open it up to my colleagues on the call quickly and ask if you want to mention any of the work that's happening in these spaces. And I guess they don't. So Heather, I'll pass it back to you.
You bet. A few things that we wanted to call out as areas top of mind where we're prioritizing and looking at where we can really double down as those move forward include healthy aging, youth engagement across all health topic areas as a driver for solutions, tobacco and vaping prevention. So looking at that at the local, the municipal level, but also at the school-based level, community safety collaboratives, which I mentioned already, access to healthy foods, and economic security and how that impacts all facets of health. And what are the levers where public health can be a presence in that space. Some of the things we've done have been promotion of the child tax credit, that type of thing.
Thanks, Heather. I don't remember which of us was going to do this slide. I'll go ahead and start.
Your first
So-
time, second. Yeah.
Okay. Community Health Improvement Plan. So as you probably know, these Community Health Improvement Plan or Public Health Improvement Plan, as some folks call them, are required every 5 years by public health departments in the state, both by state law and by just best practice. So we are using the community health assessment and building off of that Tri-County completed in 2022. It's really a 5-year community-centered plan that develops county priorities with local strategies and local action. So as I mentioned before, our plan is being really developed and guided and will be implemented by Adams County Thriving Communities Collective. Our priorities are economic security, housing, and access to care, and we are in the kind of place of really looking at what else is going on in the community, what can we kind of, where can we pull together and align efforts for greater impact. We have, I think, 4 goals under each of them, everything from kind of helping people find jobs to working with employers on kind of broadening how they're looking for hiring, working through some of the barriers that they have. I won't go into detail, I think, on all of them, but I'd be happy to share more as we continue to work through them. And I think that is it, except I will note that as Arapahoe kind of finalizes their priorities, we're looking forward to really working closely with them too, to see where we can have alignment.
For Arapahoe, we'd love to call your attention to the hyperlink on the right side and an event that we have coming up on Tuesday where partners from across the county will be coming together to hear some takeaways from our recently completed community health assessment and talk a little bit about capacity and interest, feasibility to address the key issues that emerged through the assessment. And the 6 that emerged as potential priorities are listed here: economic security, health and housing, safety and health, access to physical and behavioral health care, environment, and food access and to safe and healthy foods. So those, I'm sure none of these issues that we've mentioned are a surprise to you and are ones that you have also been working on, and would love any input that you could provide as we hone that list down. The recommendation for these is usually around 2 to 3 priorities that we can use as a way to advocate for potentially increased resources or collective action over the next few years.
Great. So that's really it. We'd be happy to answer any questions. Again, we have colleagues on here who are kind of poised to respond to any questions. And then we also just have, and you have the packet. I think this starts on page 30 of your packet. So please feel free to look through the additional pages which have links.
I'm just going to start before I bring it up to my colleagues, and maybe if the mayor has a couple questions. I just want to thank you for attending our Pfizer committee meeting. You have done it when Tri-County, when we were about to start to, split into Adams and Arapahoe. These collaborations are very important to our city. So I really appreciate you updating us and giving us a presentation. I just had a question. I guess this is for you, Callie. So you don't have an office so much in Aurora, and I know there's no wrong door. Brighton is kind of far, but do you intend, is it maybe in the future in your strategic plan, is it maybe the possibility there could be an office in Aurora to maybe serve our residents a lot?
Yeah.
I mean, I'm not saying you don't serve them, but I'm just saying to maybe give them more access.
Yeah. Thank you for asking that. We are looking into that closely. We recognize there's a need in Aurora. And so I think that's on our kind of future planning list. In fact, it's something they're actively working on now, is to try to understand need and locations and potential space. I would say we also, recognize that there are services in Aurora right now that Arapahoe County Public Health provides, and we're glad for that. And then the other thing is that we have, and Darcy, if you want to, I'll speak to this, but if you want to speak up too, we do have mobile services that we're ready to deploy in Aurora, and we're working closely on co-locating with the Village Exchange Center and the Aurora Day Resource Center. So we do feel like we have a foot in the door a little bit in Aurora. Do any of my colleagues want to speak up?
Hi, Kelly, it's Darcy.
Hey, Darcy.
I could add that we have 2 mobile units and 1 on the way, that whoever in Aurora says, we need you here for this event, or we need you here, like, for example, the meningitis issue that came up, we can deploy those units wherever the community needs. We're ready, and we know, especially through our harm reduction team, that has been a corridor. You can't have too many services in that space. So always ready and willing to go to your CBOs and park in their parking lot and make things happen.
Okay. And then I guess my second, I'm sorry, Callie, I didn't mean to interrupt.
Oh, I'm sorry. I was just going to introduce Darcy. She's our Director of Nursing.
Okay, nice to meet you, Darcy. And then my second question is, in my ward in particular, I represent Ward 5, so I have a larger, older adult community, called Heather Gardens. Where are your resources to really help? I usually give information. We have some citywide information, but there's always information that I'm asked about, from other agencies that can help the individuals that live in that community, which is over 1,000 residents. Yeah. So we can talk offline about it, but is there a resource list on your website that really it's pretty comprehensive?
That's a great question. And I know we had a couple speakers from Arapahoe County Public Health visit Heather Gardens and give some presentations last year. And I think they mentioned it was one of the most enjoyable ones that they had done. I can double check with our lead for healthy aging. I'm not sure if we have a customized resource list. That is a terrific idea if we don't, however. So I'd be happy to circle back and see what we might be able to connect up.
Okay, that would be great. Yeah. I think that would be really important, especially since, I was at large for 8 years, but being at the ward council member and just being in this district where I do host town halls over there, there is a lot of interest in resources in general. So any kind of comprehensive list that we can help with our older adult as well as our youth as well, because I'm kind of engaged in that as well, that would be really, really helpful. So some kind of comprehensive resource list that the county can provide would be very helpful for our community, not just my ward, but I think around the city. So,
yeah. Thank you for bringing that up. I will also work on our side and make sure you have access to whatever we have available.
Okay, and I have your information, so I'll reach out as well. That's all my questions. Councilmember Jurinsky, do you have any questions or comments?
I don't have any questions.
Okay.
I just really hope that, Tri-County was split up for a reason. And Adams and Arapahoe, you're not called dual county, you're separate counties. I think collaboration is important. But I hope that we do stick to data driven results, and quite frankly, Tri-County fumbled the handling of COVID, and I hear that there are many leftovers from Tri-County that sounds like have implanted themselves into Adams County Health, maybe a couple into Arapahoe County Health. And I hope that everybody has learned, and I hope that you guys truly mean your mission statement. I hope you truly mean everything you said, that you're here to help people, and you're not here to impede on people's lives, that you're not here to impede on businesses, and that you truly are here to help. That's all I would say.
Thank you, Councilmember Jurinsky. Is there any other comments or questions for Adams County Health and Arapahoe County Health?
Yeah, I have a question, if I could.
Sure.
Where is your so I understand Adams County's physical presence in Aurora, but Heather, where is the northernmost location you have in the county?
That is our I'll Altura location at
Okay,
Colfax and Chambers.
okay, great, thank you.
Well, again,
That's all I
thank you
have.
so, okay, thank you so much, Heather and Callie and all of your staff that was here present today. We really do appreciate it, and we look forward to the continue working together in collaboration. So I really appreciate your time.
Thank you so much. We appreciate the
Thank you so
opportunity.
much. Have a great day, everyone.
You too.
Thank you. Bye.
Okay, our next item is going to be our state legislative update. And then we're going to Liz will be providing the 2024 legislative session recap. So I don't know who, Peggy, do you want to start?
Sure.
Okay.
Happy to kick it off. Happy summer to everybody. I can't believe we're almost to the 4th of July already. It seems like we were just in the last week of session, but we have started to get into interim activities. Obviously, the primary at the end of this month will weigh in heavily as we look to next session. Of course, there's some big congressional primary races that everybody's watching closely. And then at the legislature, there's a handful of important primaries that I think will help determine issues and priorities for next session. Representative Elizabeth Epps is being challenged in Denver by Sean Camacho. In Aurora, Senator Fields' open seat, she's term limited and running for Arapahoe County. Representative Weissman is running for that seat and is being challenged by Idris Keith. Big seat up in Arvada in Senator Zenzinger's seat. Representative Lindsay Doherty is running for that seat, as is OB Azzetti, and that's going to be a big race. So, like I said, there's a handful of these that I think will determine as we move into the general elections what the priorities for next session will be. We did get a state economic forecast that was presented to the Joint Budget Committee yesterday. Just kind of the highlights of it. The general fund is expected to end this 24-25 year with a 14.5% reserve, which is about 86 million under the statutory reserve requirement of 15%. This, of course, can change based on the ballot initiatives that will be in front of the voters in November and legislation that may pass in the 2025 session. The general fund revenue is expected to decrease by 1.7%, which will be about 17 billion. After adjusting for tax credits that passed this last 2024 session, the state revenue subject to Tabor is expected to exceed the referendum CCAP by about 330 million. They do expect that it's possible that the state revenue subject to Tabor may fall below the referendum CCAP, which would cause the 24-25 budget to be constrained. So we'll see, but interesting. The one big bill, as you recall, the property tax initiative that were filed in after HH failed. There were several property tax initiatives that were filed in the last week of session. The legislature passed bipartisan legislation to address property tax that although it was compromise legislation and a lot of people came to the table and supported it, it didn't get everybody to the table and get everybody neutral. Colorado Concern still has a couple ballot initiatives that are out there. I know Tatsi's going to talk a little bit more about some of the ballot initiatives, but if those pass, it would have a pretty dramatic impact on the budget. I think the governor's budget director said yesterday that could be a $2.5 to $3 billion hit. So that'll be an interesting one to watch as well, to see one, if they pull those ballot initiatives or if they they pass at the ballot box in November, that'll have a big impact. And I'll actually just tag out with Tatsi and let her talk about ballot initiatives. And then we can answer questions at the end.
Great. Thanks, Peggy. Let me just call up my little cheat sheet here. As Peggy said, this election year, two initiatives are currently on the ballot, and that's 105, that's 50, which is the voter approval to retain additional property tax revenue, and the 89, right to abortion. Those two are on the ballot right now, with 23 initiatives having been approved for signature circulation. That deadline is August 5th. I don't know where the 20 came from. The Legislative Council is working on 19 initiatives and referenda for the Blue Book at this point, and there are 7 referenda on the ballot. The two pieces that Peggy was just talking about, the Initiative 50 and Initiative 108. Initiative 50 would have, it proposes a 4% annual cap on statewide property tax revenues and requires a statewide vote for any local districts to exceed the cap. The 4% revenue growth would hinder new development, requiring statewide votes for local infrastructure and housing projects, while likely failing to keep pace with inflation and limit local government's ability to maintain existing services or meet public demands for new services. This measure will appear on the ballot because it amends the Constitution, and it will need 55% of the vote to pass. This information came from a meeting with the Tax Commission, where the Legislative Council had addressed their concerns and questions. Initiative 108, should it make the ballot, proposes reducing residential property assessment rates to 5.7% and non-residential rates from 29% to 24%, with the state general fund backfilling local district revenue losses. This change would cut local property tax revenue by $3 billion in the first year, requiring the state to backfill the loss. It would also lead to significant budget cuts, especially in higher education, and make it difficult to maintain current K-12 funding and other state and local essential services. It only requires 50% of the vote, as it is a statutory change to the law. There are, as I mentioned, 23 initiatives. I can go through those if you want the titles, but I think that the biggest.
If you could just send them to us, I think it might be
Sure.
of interest to the committee. So I think just sending us to them, and then we could do the link and kind of look at them and go from there. If we have any other questions, then we can go from there, because that's quite a few to go over one by one.
Thank you, Councilwoman.
Yeah.
And then Cammie, did you want to close out here?
Sure, I'm happy to. Hi. There are 28 interim committees that will be meeting interim course of the next several months. Some of the interim committees have been tasked with studies. Some have the ability to propose up to 5 bills. I thought, going through some of the interim committees that may be of interest to the city, there is a Black Coloradan racial equity study, and that will purely be looking at a study, not offering legislation. There's also a commission tax, which will look at increasing property taxes and review best practices for short and long-term property tax relief. There is also Access Advisory Board, and that will look at making the legislative process more understandable for populations with limited English proficiency. And of course, the Transportation Legislative Review Committee, we watch closely, and they will offer potential legislation. In the last touched on by the Health Department as the Legislative Emergency Preparedness and Response Committee, and they're tasked with planning for responses to a disaster. So those would be of interest to the city. We also, there are substance use disorder committees, and certainly we are at any other may be of interest to monitor.
Just a question. I guess what I wanted to ask you, Cammie, is you gave us ones that would be interests of the city. You said that there were certain ones. Who determined that these were the ones of the interest of the city? Who made those determinations? Because did that go to Liz and then they went to the departments? Maybe Liz can answer that. Because I think it's important to maybe get the list. I would like to see what the list is and then how we're determining what the nexus is to the city. Because you said these are the ones that we chose. So who determined that?
I'm sorry, I just went through and identified possible committees of interest.
Oh, okay.
I will, and I'm trying to speak on behalf of the city, but I am happy to circulate the complete list to Liz, provide it to the committee.
Okay. Yeah, I think, okay, I'm sorry if I misinterpreted. You said these were interests of the city. So I was just trying to see when was this determined and who by? Because I haven't even seen the list, the advisor committee, I haven't seen the list. And I know we go through and talk to city departments, but with the ones that you listed, I just wanted to see what was the nexus. I see some of them and how that was determined. So before we do this, if we could get the list over to maybe Liz and circulate it to departments, and then that could kind of be the focus where we can kind of, the committee can kind of weigh in and see if this is what we want to focus on per legislation in the future.
And those were merely just suggestions.
Okay.
By any means the end all be all or complete list.
Okay, understood. Okay. Is there any questions? Councilmember Jurinsky. Okay, doesn't look. Mayor Kaufman, do you have any questions or any thing that you want
No questions.
to follow up on? Okay.
No questions. We had discussions, I think, last legislative session, but we came in too late with the vehicle registration issue. And so we will be working on that again. And I think, I'm trying to remember the name of the state legislator who represents the very southern end of Aurora.
Representative Hamrick.
Hamrick. Okay, so we do have a meeting. Maybe Liz can comment on that with Representative Hamrick.
Okay,
yes,
thank you, Mayor, for that update as well.
Yes, so we do have a meeting with Representative Hamrick on Monday to discuss the potential draft legislation for motor vehicle registration. We also will have to do some additional stakeholding work with Department of Revenue, Governor's Office, and other agencies with that as well. So once we have that meeting with Rep. Hamrick and we identify next steps, we will be moving forward on that.
Okay, thank you for that update, Liz. So is there any other updates or anything, comments from Peggy, Tatsi, or Cammie on anything before I move forward? Okay. Okay, Liz, you're going to give us a recap of the 2024 legislative session.
Yes, so I will actually be also turning it back over to Tatsi, Cammie, and Peggy. They've done excellent work over this past legislation. We've been incredibly engaged in a very positive way. So I'm really looking forward to sharing the update that they've put together with all of you and answer any specific questions. I do know, as Councilmember Ed Lawson and I have discussed, we'll be talking a little bit more about some draft legislation for the city to pursue at the July meeting. So we'll have that discussion for everyone then. But turn it over back to our amazing lobbyist team for them to give their end of session report.
Sure, happy to start off. We have a big focus this year again on affordable housing. As you recall, 2023 session, the governor's office pushed late in the session affordable housing legislation that really put mandates on local governments and pulled away from local control issues. We were able to defeat that in 2023. Last year in 2024, he came back with legislation that was parsed out into 5 or 6 different bills. As a refresher, you'll recall we saw ADU legislation, mandatory occupancy limits, transit-oriented communities, parking minimum legislation. So there were several big bills that we worked on. We successfully amended many of these bills. I will not go so far as to say that the bills were in a position that we supported them in the end, but we were able to make some significant changes and work with our associations on some of those bills and really make improvements to them. I think long term, we'll continue to see affordable housing legislation in the future because obviously there is significant concern that these bills are not going to solve the problem. How local governments handle it, I fully expect we'll see lawsuits as a result of these. Some local governments may not enact these legislation or the requirements of the legislation, but we will continue to see affordable housing legislation in the future for sure. The other thing that I guess I worry about a little bit with the legislation is, unfortunately, I think because there were so many bills that legislators voted in support of, that it probably hindered the foundation of local control and local governments being able to regulate. So it makes me a little bit uncomfortable that it's going to be easier for legislators or more comfortable for them to vote to continue to, pick away at that. So just something to think about in the future. I worry that it'll expand beyond affordable housing, but I think we will continue to see affordable housing legislation in the future. We also saw legislation around criminal justice that we've seen in the past. I see Judge Day here, and that will continue to be a big issue. I'm not sure if Judge Day wanted to talk about any of those bills or any of the work that he's involved in this summer on those, but I know that will continue to be an issue for next session as well.
Judge Day, do you have any comments?
Nothing specific. I don't think that we're going to get any headway with any of the interim committees as it relates to data sharing, but I'm hopeful that after the primary that may spark some interest in whoever proceeds forward after the primary. So it may be worthwhile to have conversations with people after the primary. So hopefully that will hopefully spark some new interest. We lost a little bit of steam from the task force with this legislative session for different circumstance, but hopefully we can get that again back before people, because I think there is a lot of strong interest for both the state side and from the local side. But other than that, I haven't heard of anything that is in the works on criminal justice legislation for 2025, but if I hear anything, I'll for sure bring it forward to the committee.
Okay, thank you, Judge Day.
You bet.
Is there anything else?
I was looking at the end of session report and maybe some of the traffic safety bills that went through. There was a vulnerable road user bill that we worked on with the sponsors on red light cameras and cameras around the city. And that's more of an infrastructure bill, basically. I mean, it was toned down a lot because of the transit bill that went through that raised rental car fees. But that was something that we supported for safety reasons, public safety reasons.
Right. Well, I'll just make a comment. I read the report and, we've been doing, I just want to thank all of you, Peggy, Cammie, Tatsi, Liz, everybody, Judge Day, everybody who's on here from all our departments. Not only do you do your jobs, your regular jobs, city staff, but then you go and actually do the legislative process. The overall thing that I got from this legislative session, and I think you're right, Peggy, there is some with local control, and everybody brings up local control, but it's very important because cities are different. We're not like Westminster, we're not like Denver, we have some comparable things, but I do have a fear that that is going to be an issue going forward. And that's what I really saw at this legislative session compared to the one before. Now, they were chipping away, but it seems like they chipped away a lot more during this session on local control on multiple issues. So that is something that as cities, as leaders, we're going to have to, I don't know, tackle, advocate to make sure that we keep our control of our cities. So that's my concern going forward. And I don't know how to apply this or what we need to do, be more boisterous. I guess we'll see how the elections turn out, but it really is going to be really important for us to try to do that as much as we can, if we can. So, but I appreciate everyone, all you have done, not only now, but in the past as well. I think topics are going to get even more complicated, and as we're moving forward with the legislative session, and I think all of the expertise and all boots on board from cities and from all of our elected leaders are going to be very important in the future. Mayor Kaufman.
Well, I just want to thank them all. Thank you all. Thank Peggy, Tatsi, and Cammie for all your work, Liz too, during this legislative session. And I've known Tatsi and Peggy since the earth was cooling. And I've known Cammie's dad as well since the earth was cooling. So we've been around for a while. Thanks.
Yeah. So I just want to thank you all, and I'm looking forward to seeing how we're going to move forward with the legislative, probably trying to get ahead and be a little proactive on some things. So hopefully time is coming. We're already halfway in the year already. The legislative session is going to start pretty soon. So I look forward to working with you all again on that. And I just want to give everybody on here a thank you as well for everything that you have been doing on the legislative process and on behalf of the city of Aurora. So with that being said, Councilmember Jurinsky, I don't know if she's still on here. If she's not, I don't hear her. Okay, I think she's off as well. So our next meeting is going to be July 19th. I look forward to all of the updates. Is there anyone else that would like to speak before we end our meeting today? Okay, I don't hear anything. So with that being said, we're going to adjourn the meeting, and I hope everyone has a very good weekend. Bye, everybody.
Thank
So
you.
long.
Bye.
Thank you very much. Enjoy your summer.
You too. Thanks.